Hello, my name is Alicia and today I'll be demonstrating tracheotomy care on my patient. I am in my school uniform, name bag is present, and no nails or nail polish or jewelry is on my fingers or hands. So first I would verify the order, making sure it's the correct order. From there, verify my patient and then the 6 rights. If my patient's alert orientated, I will explain the procedure and explain if you have any discomfort during this, raise your hand. From here, I would take vital signs to monitor my patient, making sure he's stable and his O2. Originally, you have 2 people doing this, so one is monitoring the patient, or if you need assistance to help you with assistance. But in this case, I'll be doing it by myself. From here, I would raise the bed in high Fowler's position and in my comfortable level. And it just explain to the patient, if you're having any discomfort, raise your hand again. Okay, from here, I will hand hygiene, prepare my sterile film. My sterile gloves will be right there. With the package, you would want to open the container away from the package to not break your sterile film. And then I would open this from the outside and shiny part on the bottom. I'm going to grab my little box here, the container that contains all the tools, and then dump them in the middle. And then from here, I am going to apply my hydrogen peroxide normal saline on one end, and then the other side's normal saline. I'm going to place it right here close to the patient. So when I remove the inner cannula, I'm able to it'll be easier for me to put it back in. I'm going to touch my laptop because it is turning off. Alrighty, so I would hand hygiene again, put my gloves on to remove the other stuff. Alright, so I'm going to remove the inner cannula and then place it into my solution. And then remove the gauze and the little pad that's here from the patient's skin. And then discard this. Alright, I'm going to hand hygiene again and then apply my sterile gloves on. So you want to touch the outside of it. And then I'm going to open it. And open the other side. Okay, so I'm going to grab the right one, but grab the cuff of it. Making sure I'm touching the inside of it, like the cuff. Then I'm going to grab the other one and then go under the cuff and then apply my hands. Alrighty, and then from here I'm going to maneuver, making sure my gloves are comfortable. I'm going to touch my laptop because it's turning off, but I'm still sterile. Alrighty, I'm going to grab this and move it to the side. Alrighty, from here, my left hand is my soil hand, so I'm going to use that to clean the inner trach with the brush. That's right here. Alrighty, so I'm going to grab the trach, inner cannula, clean it. Alrighty, so I'm going to toss this and I'm going to paste the trach back as I received it and making sure it is locked. Alright. Alrighty. From here, what I should have done before is place my Q-tips in the normal saline solution, but I'll do that now. So I could use that to clean the patient's skin and outer skin of the trach area. So now I'm gonna hand my left hand to the Q-tip and then clean. Okay, so now that it's cleaned, I'm gonna pat dry it. And then trash. Alrighty, from here I'm gonna apply the new gauze. I'm gonna touch my laptop again because it is turning off. There we go. Okay, so now I am not sterile anymore. And if the patient needs any suction or oxygen during this, I would stop and apply suction or oxygen, or ask my partner to. Alrighty, from here, I'm gonna remove my tray so it's not in the way. And then do the one bow tie method. And then for this, you want to make sure you're keeping the trach stable so there's no complications to it. Alright, so this is trash. Alright, so I'm going to grab my new tie and then tie my patient. Alrighty, so from here, I'm going to touch my laptop again because it's turning off. So from here, I'm going to do a little knot in the back so it's not facing the patient. And I want to make sure after I do it, there's some little bit of space, but not enough where the trach's going to come out. Alrighty. So I would check the tightness of this. And then due to limited supplies, I do not have an extra gauze, but I would apply a gauze right here so the knot doesn't give any skin irritation for the patient. So after that, I would redo my patient's vital signs, check their O2. If suction's required, do that. Remove my gloves. Trash, provide hand hygiene. Patients alert orientated, talk to them, ask them if they're okay, if there's any pain, no. Lower the bed in a safe position, give them the call light. Exit the room, hand hygiene, and just document that the tracheotomy care was successful.